Hey, good afternoon, everyone. I'm WPTV's Chris Gilmore here during your late lunch hour with important Facebook Live. We wanted to talk to you about a topic that's been really dominating the headlines lately. That is, of course, vaccinations for COVID-19, specifically the booster shots, the third shots. A lot of people have been contemplating. We've been waiting on word from the FDA and CDC, but I want to go ahead and introduce you guys to our expert today, somebody who you might have seen on WPTV airwaves in the past, Dr. Leslie Diaz, a local infectious disease doctor here in Palm Beach County, who has been working pretty tirelessly, I'm sure, over the past year and a half in terms of not only treating patients, but also educating people. That's almost as important about what's going on in the pandemic and how to properly protect yourself. Dr. Diaz, how are you doing? Thanks for joining us.
Hi, Mr. Gilmore. Thank you very much for having me. I'd be happy to educate and pass the word around.
So we're on the cusp of a pretty big announcement. A lot of people have been wondering, hey, I got vaccinated however many months ago, 6 months ago. They're worried about the efficacy of the vaccine. Is that a valid concern?
The efficacy of the vaccine is there. It's been proven that it is a very good, effective vaccine. And the one thing that I can say is that it prevents 100% mortality or deaths. We are seeing this in the front lines. Patients who come in vaccinated, we have not had one death yet, and that's a good thing. That tells me that the vaccine works. It may not work the 95% that originally was out there, but it works. We don't know exactly where that dust settles. Is it 70%? Is it 75? Nobody really knows, but it still works, and it works in mitigating the severity of the disease, and also works in preventing death. We see
That's an important point because I've seen a lot of my friends and family on Facebook, shaming the vaccine as what they thought would be a cure. It does not prevent you from getting the coronavirus, any of these vaccines.
That is correct. This Delta virus is a strain that really throws all the rules out the window. And we have to realize that it's kind of like dealing with a brand new virus. It's very transmissible. It's very effective in getting its job done and survive the actual propagation of it. And therefore, it causes more severe disease with less viral load of exposure. So it's kind of like dealing with a different monster.
The vaccine. We touched on a hot button topic here, Dr. Diaz, because I was going to encourage everyone who's watching to go ahead and comment, but we're already seeing a lot of comments stream in. We are taking these comments live. We're seeing them. So right now, guys, if you have any questions specifically for Dr. Diaz, go ahead and pose them. She knows a lot better than you and I do about what's going on right now and the proper course of action. Specifically, what we're covering today is the third or booster shot. This is for Moderna and Pfizer. Right now we're only under emergency use authorization, from what I understand. This is gonna potentially go ahead and open up the door for a third booster for those who are immunocompromised. And I believe there's been some other recommendations as well. Go ahead and tell us, what are we waiting for, Dr. Diaz?
I think what we're waiting for is for the dust to settle of what is the exact concentration that gets us what we need as far as the boosting effect of the original immunity. I think they're still working on that. I think,
and I'm seeing this. So just going through the comments, I want to make sure that people know that we're listening. What constitutes immunocompromise for those people who would be at the first of the line for these booster shots?
Great question. You have to consider first of the line as being transplant patients, autoimmune patients that have immunomodulators on board or any other type of immunosuppressant drugs to treat the disease on a chronic basis. Patients who, for example, are diabetic and are known to have some degree of immunodeficiency, especially if they're out of control and they don't have very strict control of the diabetes. And also patients who are, for example, progressed HIV disease, that are not controlled with their medications,
Right.
and so forth. So those are examples.
I see somebody asking Michael about rheumatoid arthritis. Michael Canfield, is that something that constitutes as a immunocompromisation?
Absolutely. Any autoimmune disease constitutes that. And you really, you know, in my book, you really don't need to be on immunosuppressants. Just the disease itself causes a degree of immunosuppression. It's a small immunosuppression. It's not huge, like when you're on Humira or something like that. But it's there, and so those are people that should be first in line, even with just a diagnosable autoimmune disease.
And I see, and there's a lot of people, because right now, we're dealing with nearly or just over 50% of the country vaccinated. There's some people here in the comments I see saying, for instance, Stacy, we see you there. How can I not be vaccinated and still go about my daily life and not have COVID? Are they playing a dangerous game out there if you're going about your day to day without being vaccinated right now?
Let me tell you what I say to every unvaccinated individual that I meet on a daily basis. It's not if you're going to get COVID, it's when. So it's almost a for sure thing. The insurmountable amount of patients that are coming into the hospital that we can't keep up with in a regional basis. It's just it's outstanding, and so that tells me it's because it's out there. That tells me that the virus is being passed around significantly. And in the state of Florida, there hasn't been any limitations for gatherings at all. So therefore, as long as people are going to be gathering and as long as they are going to stay unvaccinated, it's not if, but when you get it.
Stacy Corbo is asking a pretty good question. I'm curious as well. Vaccinated people spreading the Delta variant as well.
That is true, but the amount of viral load that the vaccinated individuals are spreading is not even near the amount that the unvaccinated individuals are. That's number one. Number two, if you really read the science, the vaccinated patients really have been vaccinated because they want to protect themselves. They want to protect themselves into, okay, I'm not going to get the severe disease that unvaccinated individuals get. And guess what? I'm not going to die. So
Okay.
for that reason in itself, you should consider the vaccination. Now you take that a little bit, you step it up a notch and you have to say, it's my civil duty to not infect my fellow man. And if I'm going to
cut you off, but I see a lot of people who are hearing you and want to know about their ability to be at the front of this line for booster shots, asking a lot about cardiac and pulmonary issues. Are they also up for consideration for this booster shot?
That's a good question. I think they're going to have to be hand in hand or in line with getting vaccinated for the autoimmune or getting booster shots for the autoimmune individuals. I think they have to be kind of parallel to them as well, because as we know, patients who have underlying lung disease and they get COVID, they don't do very well. Also, patients who have heart disease. I've seen heart attacks being caused by the virus. So it's a real big problem. And I think those individuals should be at the front of the line as well. But I don't know where the dust is going to settle with that yet.
Right. See, there's another pulmonary issue with the lymph nodes and all that. We're seeing a lot of more questions come in, some of them asking, and I don't know if you're the best to answer this, where are these booster shots going to be available once this guidance is passed, if it is passed?
I foresee them being propagated everywhere. Just the same places that are vaccinated individuals, I think, will also get deliveries of booster shots once they have determined the best concentration levels for these patients.
And for the general population, if I'm hearing you correctly, they're not going to see a huge drop off in efficacy after this first 6 months. It's not going to be as effective, but still very effective. preventing severe COVID symptoms is what I heard you discuss earlier. But still, a lot of people, we saw it go in waves in terms of the demand for this vaccine. We saw it at a very high premium in areas here in South Florida, and that transferred into a period where it seemed like nobody wanted. You couldn't pay people to get it. Do you see this booster shot being just as scarce, and when people start wising up to what's going on?
In the beginning, probably so. It's gonna take the same route, I think, as the original vaccines did, because you can only produce so much for the nation, and so we're gonna get a snippet of that, and so it's gonna be scarce in the beginning. And I think it should be left for those people who are immunosuppressed. I also want to add to that patients who are elderly that got their vaccine in January and February, those individuals also need to be taken into consideration, even if they're healthy. Because what I'm seeing a lot of these individuals coming in and not having any antibody levels. And that's kind of scary, because then you only are left with the memory immunity that you can have from the vaccination. But you don't have any readily available soldiers out there in the circulating bloodstream to be able to, nip it immediately.
Right. Okay, everybody, I see your comments coming through. Again, we have Dr. Diaz here. If you have any questions for her, I'm going to continue to pepper her because this is a topic that I'm very curious about as well. In terms of the people who are going to be getting this booster shot, we're talking about Moderna and Pfizer only. But we know that Johnson & Johnson is also a big player in terms of the vaccination world for COVID-19. Is there an ability to mix and match these, or is that safe?
Using the science that I know and the common sense put together tells me yes. I think there is room of mixing and matching. As a matter of fact, there are studies that are being done right now looking at that specifically to make sure that it is okay to do that. But I would tell you, yes, my prediction is that you could do that, and it would work the same.
I'm seeing a lot of myths and facts being thrown around in the comment section. We covered this during our newscast earlier today. I'm going to use you being here as an opportunity to go ahead and be our truth test here. A lot of people have been throwing around the idea that getting the vaccine causes you to be magnetic somehow. You've seen all the videos posted online about people attaching metal to their arm right after getting a vaccine. What's your response to that? I can see you shaking your head already.
That's baloney. In a nutshell, that's a lie, and it is a phenomenon that does not exist in reality,
And there's also speculation that the vaccine causes infertility. Is that anything you can speak to?
Yes, it's there has never been in the studies that were done, and I keep reminding individuals, what are these studies that were done for the vaccine? Double-blinded, placebo-controlled, in over 100,000 individuals worldwide. Just in the United States alone, anywhere from 30 to 40,000. So, you have to really look at the powerful data that we get from such a study. And the first thing that needs to be said is, this study is good. This study is the best study that we've ever done in the history of medicine. And so it gives us a platform and a forum to be able to say we can rely on the data that we're seeing, because it's a lot of subjects. So bias is eliminated when that happens. So therefore, in all the study, the major studies for the vaccine, we did not see any evidence of infertility or any problems with conception.
Okay, another great clarification I'd like you to point out. What's the difference in terms of the passage of these vaccines being emergency authorized versus being fully approved?
Emergency authorized is more in the flavor of, okay, we are looking at this very intensely. We're working around the clock with different scientists, looking at the data that the studies offer to us, and we're crossing all the T's and dotting all the I's. Okay, and so they give emergency use because we see that the safety factor is there after we did that. After we looked at it very intensively, the safety factor is there. What does that mean? That means you're not going to grow a third arm, okay? That means you're not going to be magnetic. That means that you are not going to have infertility problems because it was not observed in over 100,000 individuals, okay? So that's what emergency uses. It's more focused on safety. How safe is this product? Yes, you have to show efficacy, which is how good it is, but the main concern is how safe it is. And that's what was shown in the studies. The full approval is what happens over time. Let's relook at these subjects and see what happened over time. Did that safety protocol or safety issue kind of panned out and continued that way? And the answer is yes. And until they have all the answers in their pockets, they will not fully approve it. And so far, a year and 6 months later, the safety issue is still there. It's a good vaccine, and it's very safe.
Okay. And as far as going back to the boosters, as soon as today, we can hear from the CDC and the FDA the emergency use authorization amendment for the booster shot only for the immunocompromised individuals. Is it safe for people who are not in that category to go ahead and get that third shot, that booster shot?
I think they're looking at all different individuals, and those individuals are included in there. If it's safe for the immunosuppressed, it's going to be safe for the healthy adult, no question in my mind, because we already proven that. We already proven that about the vaccine itself. So it extrapolates into the booster shots because there's no difference. There's no difference in what you're getting other than the concentration level, which is going to be less than the second. I presume that's going to be probably less than the second shot, but it could be more. That may be the one that shows the best efficacy or the best outcome.
Now, I assume if you're going to go get that third vaccine, you're going to show up with your vaccine card issued by the FDA and CDC. Do you see any physicians or practitioners stopping you or any roadblocks on your way to get that third shot until we see more guidance from up top?
If it's going to be scarce in the beginning, I suspect that they will require some type of proof that you are immunosuppressed, because they want those individuals to go first, and that's understandable. So I think that would be the only roadblock, but there should be an easy fix if you've been diagnosed with a disease that warrants it. So that should see no problems with that.
Okay, a lot of people asking in the comments, Melissa, we see you. How soon can you get your booster shot?
I think within 3 to 4 weeks, I think. Oh, you mean soon as far as after you vaccinated?
Right, I guess they're waiting for decisions to come from the
right. I think in 3 or 4 weeks, we should have booster shots available.
So if you got your vaccine within the past 4 to 6 months, should you still be okay right now until that period?
Not necessarily, because it has been shown by different studies that immunosuppressed individuals do not respond to these vaccines as well as healthy adults. So it's hard to say how well protected you are 6 months later without maybe doing an antibody level. And sometimes those are, you really don't know what you're dealing with. So it's best to say that in the general sense that if it's been 6 months and you're immunosuppressed, you should get the booster shot. But I'm sure they will define that a little bit better.
Okay. Cord is asking a question here about how many patients have received the vaccine worldwide that have resulted in some sort of morbidity or mortality. Do you have any ballpark or educated?
I can't tell you the exact number, and they really have to allocate side effects with any little thing that happens and any major thing that happens. And I can tell you that major occurrences are few and far between. The more common complications could be local arm inflammation, which was very common. That's not, I've seen that multiple times in my patients, associated with arm pain, redness. Sometimes it's even mistaken for cellulitis, which is an infection of the skin. That's all inflammatory response. If you don't have other allergic type reactions, that is not an allergy and should not remove you from getting it.
This is a good question. Also coming from Melissa. She's asking if you are compromised and looking to get your booster shot, are you going to need a letter from your physician?
That's a great question. I suspect you're going to need something. If they want to really make it very strict for the immunocompromised to get it first, like they did in the beginning, where they made it very strict for the older population to get it. And they went in kind of in different waves as far as who should get it first, and then go on and on and on. So I foresee the same thing happening if there's a limited manufacturing.
Okay, I don't want to get too off track, but another topic very closely related to this at the top of a lot of people's minds is, how soon are our children going to be able to get vaccinated? And that's also, up to more testing and trials and CDC and FDA conversations. Do you have any insight on that?
I do. And when it comes to children, like it should be, they really don't hurry anything, and that's understandable. So they really want to make sure that they have captured all the numbers of participants that are necessary to make it a great study or an excellent study, so we can really say to the public, we as scientists rely on this, and it's really good data, like we had from the original vaccine in adults data. So I foresee that they're going to take their time with this, as they should, and I don't think that there's going to be anything coming out anytime soon. Maybe, if we're lucky, before the end of the year.
Okay. The other topic I wanted to talk about, we saw the governor in Jacksonville today promoting the use of remdesivir. Go ahead and tell our viewers, what are those monoclonal antibodies, and when are they appropriately used in terms of response to COVID?
So the remdesivir and monoclonal antibodies are two different things. The remdesivir is the antiviral that we use once you come into the hospital and you're sick. You're sick with hypoxia or low oxygen level. And that's the one we initiate right away. We use it up front early on in order to try to make the best difference for the patient's progress. The monoclonal antibody is different. The monoclonal antibody is geared towards attenuating or tweaking down a little bit the inflammatory response that occurs with your immune system against the virus. So it tweaks a specific type of your immune system steps to be able to do this. By doing this, you kind of inhibit the virus from doing its thing, attaching, moving on to do whatever it does pathophysiologically.
So these are early responses once you've tested.
That's correct. That's correct. You have mild disease. I have a little sore throat, maybe a little cough, and a low-grade fever of 99, and achy. But I still have good oxygen level. I don't have hypoxia, and I don't necessarily need to go to the hospital. But what I propose that I think should be done is patients who already made it to the emergency room because they think they're sicker than they are, because it's all new to everybody, and I can't blame them. They're scared. So they go into the emergency room and they get evaluated, but it turns out they may not have pneumonia and their oxygen level may be okay. Those are the individuals that we should target. Those are the individuals that should get the monoclonal antibody and sent home, because they're going to do much better, and they don't necessarily have to be brought into the hospital to be caring for them, that we really don't need to care for them. We need to be caring for the more sick individuals,
Keep those beds open as much as possible.
Exactly.
But before we even get to the remdesivir or monoclonal antibodies, your recommendation is obviously, correct me if I'm wrong, just to get vaccinated.
That's the best medicine that we have to prevent this disease and death. I mean, it's by far the best tool that we have in our armament of stuff. It's like I tell everybody, if you think that the vaccine is experimental, well, come into the hospital, get COVID, come into the hospital, get sick, and let me give you the protocol of medications that I give to my patients. That's experimental. That's experimental. And you got to think it that way.
Okay, I see a lot of you guys still interacting here. We don't have the doctor here for much longer. Dr. Leslie Diaz, an infectious disease doctor here in Palm Beach County, one of the foremost here in our area. If you have any questions for her about booster shots, vaccinations, or the trajectory of the pandemic as we go from here, go ahead and let us know. But what I wanted to ask you, Doctor, at this point last year, I'm sure a lot of us didn't foresee us still being this much in the thick of the pandemic. What do you see the next 6 months or year going for us right now if we continue on this track?
Unfortunately, I don't see us being in a very good place in the future. And it's all due to vaccination issues. Patients are not, people are not getting vaccinated. There's still a certain insignificant percentage of individuals that never will, and you're not going to change their mind. And those are the individuals that are going to be driving this issue on and on and on, and it's going to be never ending because it'll allow the virus to create more variants. It'll allow the virus to mutate, change its genetic composition, and form the different variants. I mean, even in South America, there's a Lambda variant that it's going to work its way up here if we don't get vaccinated. And I think vaccination is the way to put this, put it away and throw away the key. That's it.
Right. And just a quick recap for all those people who are just started joining us. We were talking about booster shots and whether or not it's the right path of action, but primarily who it's the right path of action for. A lot of people were asking about that, and you went through a pretty thorough list of who are the immunocompromised or those who should be considering that vaccination. I saw somebody bring up earlier our cancer patients on that list. Go ahead and give us a quick rundown of who should be considering these booster shots as we expect to hear a decision from the FDA and CDC sometime within the next few days.
The list of individuals that need the booster shot includes the transplant patients, autoimmune chronic disease, the cancer patients, whether you're on chemo or not, you should get the booster shot, and even patients who are asthmatic or have COPD that have underlying lung disease. We talked about that, and even just plainly older individuals greater than 75. You need to be looking at maybe getting a booster shot if you haven't had the vaccine recently. If you had it 6 months ago, those individuals need to be looked at as well. So that's kind of like a list. And also HIV disease that is not very well controlled and it's advanced.
Mm-hmm. Now, these are recommendations that you're giving within your medical expertise. I'm sure years, even decades of training. And this is not a politicized opinion. This is just what you think is the best course of action for our South Florida, for our country, for the world. Is this
correct? That is correct, because they have not come out with that criteria yet, but those are the population that's being looked at very with a lot of scrutiny here.
Okay. Well, guys, thank you. I don't want to keep the doctor too long. I'm sure she has a lot of important business to attend to, but we thank her so much. I'm sure this won't be the last time that you see her face on WPTV. Information and education is almost as important as, the work that's going on in the emergency rooms out there. But you heard it from the source. Get vaccinated if you can. Look into seeing whether or not you're eligible for that booster shot. We expect to be hearing a decision sometime very soon from the FDA and CDC. And until then, just do the best that you can to protect yourself, your family, and your loved ones. Anything else you wanted to add? Any final thoughts, Doctor?
The one thing that we do know about this virus is that we don't know. There's always a element of surprise, and you can't predict it. Mm-hmm. So get vaccinated.
And surprise, never thought we would be here, a year and a half or more into this. So we'll keep on fighting. But thank you so much, Doctor. Thank you, everyone, for watching.
Thank you very much for having me. I appreciate it. Bye-bye now.
All right. Take care.
You too.